Good evening, everyone. And it was really, it's a pleasure to be among such esteemed panelists and speakers.
Vaishali, I think it's not audible.
It's not audible. Guys, am I audible? Okay. So what I was saying is
একটু সাউন্ডটা একটু বাড়িয়ে দাও না please. So we want everyone to hear from the farthest corner as well, so we are ensuring that only. এটা দিয়ে দেবো?
out there? Okay. So it's really an honor to be among such esteemed panelists and speakers. And believe me, I'm being naive. I didn't know that, I was backstage talking to my fellow panelists. And yes, this is much better. I was backstage talking to my fellow panelists, and the passion they carry and the contribution they are making towards healthcare is immense, and we are going to hear from them. So shifting gears a bit, AI in healthcare. So as we have heard today, from our keynote speaker, automation, digitization, workflow management, standardization, these are key words, and these are areas which makes an industry successful. And I think AI plays a huge role in these areas. So let's hear from our co-panelists how AI has disrupted or is going to disrupt the healthcare sector. Now, when it comes to healthcare sector, it's not easy. We are dealing with patients. We are dealing with patients' data. And there are quite a bit caveats and nuances around it, especially around ethical compliance, governance. So it's a complex topic. However, we will try to delve deep into it and see where we are heading in the next 5 years or so. So my first question is to you, Arindam. Your company, and I was just amazed to hear that 15 years ago you have started the digital journey to transform medical imaging. And how do you think with the AI coming into picture, it's going to accelerate your mission or vision?
Hi, am I audible? Yeah, I think so.
Yeah.
Thanks, Vaishali. Good afternoon or good evening, everyone here. Answering your question, Softmed Technologies, that's my organization, is totally focused into the field of medical imaging applications and digital transformation of medical imaging systems. We have been doing this successfully for many years, and India, from the AI perspective, especially in healthcare, when we talk about application of AI in healthcare, it is a bit different than it is with other industries. Because in most of the other industries, it is more of intelligent decision making on process automation. But in healthcare, it is not only that, and it varies from country to country. So I would rather like to speak about the Indian scenario, how AI can help in healthcare, how this can help companies like us who are developing different health tech technologies which are catering directly to the health systems, or rather healthcare facilities. Ultimately, the beneficiaries are being the patients. So with AI, as on till date, few years back also, what we used to do, we used to digitally transform. There are equipments, there are systems, there are multiple types of systems generating multiple types of data. Technology used to integrate them and bring out a common platform or digitize them. And the first step was the digitization, the digital transformation. Now with AI, it is going to another step ahead. There will be intelligent decision making in place. If, say for example, if there is a analysis which needs to be done on a CT scan or a CT image or an X-ray image, to detect some disease, AI can actually do a triage. So, because as you know, India being a country, we always have a scarcity of specialists, doctors in the field. And we have plenty of cases. We have the power being, considering our population. What AI can actually help is optimization of time. Like you feed in 100 X-rays or feed in 100 CTs, and you tell to do a triage. AI can actually help to do a triage. It can segregate and bucket the criticality of cases, so that then the critical cases can be treated earlier and accordingly the other cases. So this itself is going to be an immense transformation in Indian healthcare ecosystem with the application of AI.
Thanks for that insightful answer. So, Ranbir, coming to you, I learned that Disha Eye Hospitals is probably the biggest chain of hospitals we have in India, West Bengal, and I'm just waiting for it to come to Karnataka as well. So, as a Chief Strategy Officer and the Chief Financial Officer of Disha, how do you see your business policies and your strategy as in this area to shift with AI coming into picture? How and whether it's shifting in a positive or in a negative direction?
Yeah, that's a good question. So if you see technology overall, healthcare is the last place where any technology is adopted. We don't have a very good example of a healthcare app which everybody uses. We all have a banking app, we all have a ride-sharing app, we have a food delivery app, where health is something that we all think about every day, but we don't have a technology that is there on our phones, except probably like a medicine delivery app, which is also like a logistic app. There is a reason why technology takes too much time to get into healthcare, because of compliances, which is the most deterrent factor. And another, it is a subjective interpretation of your condition, of your symptoms, and what treatment could be given. So objectively, you can't write a code around healthcare, because you have to have a subjective assessment of a lot of data, like that's how a doctor thinks. So I spend a lot of time with doctors. My father is a doctor. So it is like a detective trying to find all the clues, coming to what is the crime and how to solve that, and also give a judgment and execute it. So I think the solution is coming through AI. And healthcare would be one of the most dominant sector where AI is used in the future. Because how AI works, as we all know, is more of a subjective understanding of the context, rather than if A, then B, if like how we technically write code. So the adoption would be a lot faster in healthcare compared to any other industry, because we don't have the legacy technology to replace it with. People still write on paper, people still carry a large amount of files. We all have that folder in our house with all our reports, and it is still as it was 50 years ago. So healthcare does not have the baggage of legacy technology that it needs to be transformed. So it can start afresh, and it can lead the way in how AI is adopted. So anyone who is like an entrepreneur should definitely look into AI in healthcare, because adoption will be much quicker than finance or any other industry. So I am optimistic about what AI does to this industry.
Great. So it's experience and innovation at its best, probably. That's going to happen. So
Yes.
Good to hear that. Okay. So again, my next question is again to you, Ranbir. So as I heard my fellow panelists mention, that change is the only constant. And so we are in an era of change. However, change is not always welcomed very, very much. So how do you see the physicians, welcoming this change of, of this disruptive change rather of, the coming of AI and digitization in healthcare?
Yeah, there is a sort of resistance. Whenever I speak about AI to doctors, the first thing they respond with is, these things will replace us, I don't trust it. But eventually what is going to happen that the patient themselves will go back home, put all their reports in, get an interpretation from an AI, and then cross-question doctors. We already see that patient Googling their symptoms and try to find out meaning and then ask doctors about it. Doctors call them Google patients in their restrooms, but soon they are going to become ChatGPT patients. And that has already started to happen. So doctors have to adopt it because the other side is going to ask more questions. So they need to use the same technology. There would be fine-tuned models which does a lot of clinical decision support systems, and they are already there. They're already there, they're already good. We use it, we test it with other doctors, and the technology has come. It's just that how we use it and how we deploy it is going to be the challenge. It's not the limitation of the technology. Another thing is that the technology is at its worst state. Right now, any AI that we use is the worst it's ever going to be. Anything in the future would be better than what it is right now. So if it is at this level in 3 years' time, next 5 years, it is going to be really good.
That's great to hear. I used to, hear that, from my brother who is a doctor, he used to say that, okay, you know what, every patient is a Google doctor now. So now it's an era where every patient is a ChatGPT doctor. So, yeah. So my question to you, Arindam, as Ranabir also mentioned that AI is, of course, we have to work harder to become more informed now. However, AI is never going to replace human beings. But there is a notion that AI could make healthcare cheaper. Do you see that happening? AI making healthcare more affordable and more reachable? Just wanted to know your opinion on that.
It's a very difficult question to answer, actually. Because when we talk about AI, like now the entire world, everyone is talking about AI. Behind every AI algorithm, there is a huge GPU involvement, especially not in the application side, but when you are training the models. So first and foremost, you have to train a model with sufficient amount of data sets for that model to come to a certain level of accuracy. And the bare minimum accuracy percentage is nothing less than 90%. If your accuracy level is less than 90% in healthcare, that application is not a viable application to do a GTM, to do a go-to-market, or to get a regulatory certification. Because in healthcare, I just cannot build something and start it the next day in my field against the patients. It is not possible. Previously, now coming, I will take another thing, I'll mention this on a different note. Now coming to the cost, so if we, as on date, the cost of GPU is still not cheap. So if we consider the development cost of an application, from the development to training, and then coming out as a product, having an accuracy of more than 90%, that cost has to be paid by someone. Now the question is, who's going to pay that cost? Maybe when you run the application, it doesn't require a GPU. You can run an application without a GPU. when you are executing the application actually. But during the training, it definitely needs it. Now the companies like the cloud companies are coming out with concepts, like they have already concepts of non-VM based GPU architectures, so which basically will only use and bill you till the time you use it and will not have a fixed billing. Those definitely are, in that area a lot of work is going on and prices are expected to come down. But then my question here again is, where are we going to get the power, the electricity, to build so much of, to give so much, because to run GPU you need a lot of power. So whether the cost, I don't think immediately is going to lower down as far as the application implementation perspectives are concerned. Somebody has to bear it. But yes, the end user, since you will buy a lot of time with AI, suppose that if you are dealing with 200 patients a day, and with AI, with say 10 doctors or 20 doctors, and with AI, if you can reduce that, like then you deal with 5 doctors, and you can bifurcate cases, the prioritize, that itself in a different way it is going to pay you back, not the direct cost. I hope I was able to explain.
And you touched upon a very, very sensitive topic, which is basically a chatbot or an AI tool is as good as it is, as the database or how it is trained. And the accuracy level, especially with hallucination and all that, has to be minimum 90%. So you have to train the chatbot so much. So the infrastructure plays a huge role, or the data set plays a huge role in it. So Ranbir, I just wanted to know your thoughts on, how to increase the
I'll slightly
accuracy.
disagree. I think we are at this point, if I have a similarity to draw, we are at the time where outgoing calls from mobile phones were at 6-7 rupees in 2001 rates.
Yep.
So we have, and we'll reach to a point where phone calls are practically free now, in a much quicker timeline. So, and in healthcare, a lot of the costs are bundled into inefficiencies. There is just too much handling of paperwork. If you, I think everyone has experienced a discharge event in a hospital, and it gets irritating after a point of time. And it's just nothing. It's just collating of data, putting it into a piece of paper, sending it to the insurance company, them analyzing it, and giving, and matching it with your policy paper, and giving whatever you can get through insurance. That should not take 6 hours. By no means that should take 6 hours in today's day and age. So if that can be done in 5 minutes, you have saved 6 hours into 20 people working for that, the entire process chain. So we'll be a lot more efficient. The delivery of healthcare would be a lot faster. Everyone talks about waiting time in a clinic, but you get things delivered to your house, like an iPhone delivered to your house in 10 minutes. But why can't you just go to a doctor's clinic or a healthcare checkup or anything in less than 30 minutes? Every time we go to a doctor's appointment, we are mentally conditioned that it is going to take 2 to 3 hours. You have to wait, the doctor will come, you write your name in the register, your turn will come, you'll call some people you know in that building or some person you know to put your name up. It should not be a status-oriented prioritizing to be faster. It has to go through the process, and it should be less than 30 minutes for a healthcare checkup. So if it comes less than 30 minutes or less than 1 hour, cost automatically comes down. Because this is any efficient system will always have lower cost, and that will get translated to the patient expense, because all these costs add up. So we run hospitals, the electricity bill, so if you just come to our hospital and wait for some time, our per patient electricity cost is 10 rupees. Our per patient billing cost is 20 rupees. So all of these things add up, and we charge 200 rupees for a consultation. So 120 rupees is before you reach to the doctor's chamber, and then I have doctor's cost on it. So
That's a great point. We never
Yeah.
think about that. And to be very frank, we never, innovation in workflow standardization, right? That is something I think it's very important and urgent, especially as you mentioned, a lot of paperwork. Coming from the pharma industry, I can say the same thing. I mean, we are still writing, R&D work in notebooks, but automation, digitization can actually, it's an initial cost, but it's going to save us money in the future. And of course, less time and more efficient. So thanks for that insight.
That's more of digital transformation. If I talk about you are able to achieve this as on date without any AI, because it's more of digital. You have streamlined processes, and you have done a lot of digital transformation.
yeah, the issue is, as I said earlier, that you have to use AI in healthcare.
Yes.
Because it's a subjective sort of triaging, which patient has to go which department. It has not happened till date because there was no AI.
Yes.
If
But it is going to happen.
It is going to happen, but it will happen with machine learning and large language models.
Yes.
Yeah.
Because you have to subjectively understand the context of a patient. That's why in healthcare it has not happened, and every other industry it has
It
happened.
has happened. Yes.
It's going to make it more interactive with
Interactive,
AI,
yes.
that transformation.
And subjective, the word that he said. It's
Yes.
not only, it's not 2 + 2 4 always. So.
Yeah, yeah. So what I hear from you both, it brings me to the topic that it seems government has a big role to play here. You talked about infrastructure, right? You talked about a mindset change, culture change. Both of these need some government intervention. And, we are in India where I can proudly say that we have a digital identity system, implemented a digital identity system for the largest population in the world, right? Aadhaar is such a success. Do you see, and since you are related to this sector, do you see any such initiatives coming up in West Bengal or any other, or nationwide, to basically facilitate this and, help with this transformation that we are talking about?
See, government definitely is giving a lot of boost to this AI, like the AI India mission you must have heard of. Government has pumped in almost 10,000 crores into this project, into this mission project, that is AI India mission.
Okay.
And there are also chances, and they can foresee that a huge amount of AI development is going to happen. The majority of this investment is going into the infrastructure development part of the AI development. So government is going to come up, the plan is that they will come out with AI generating labs, like where you can, suppose you are an entrepreneur, you have built something, you want to train that model, you want those resources, and then you can go to that sort of a lab and run your programs, test it out.
Is government funding pouring in as well in
Government is
startups?
funding. Government is funding. Government has already initiated these things, and at the same time, but before we do AI, we need digitized data. So India still is in a place where majority of especially the healthcare sector, majority of the healthcare sector is still not 100% digitized. We still have that gap. So that gap also needs to be fulfilled, which are also in the process. For that also, government has planned something which many of you have heard of, that is the ABDM part, that is Ayushman Bharat Digital Mission, where the whole objective is to digitally transform from paper to textual data or imaging, paper to digital data, and structure it, standardize it, and make it interoperable to be readable through multiple systems. that system also through the sandbox, through the ABDM sandbox, government has also taken this initiative for almost last 10 years. They are trying that. So that is also in place. So I'm very hopeful that India in healthcare is AI application is going to take a very, very big role with government's initiatives and support.
Okay, thanks for that. Ranbir, your thoughts on this?
Yeah, with ABD, so we have eKYC already, and in the last panel discussion, we discussed on how one Aadhaar card can just track your PAN card and your entire credit history, and you get onboarded really fast. Imagine the same thing in a hospital where I put your Aadhaar card number and all your health records are uploaded. And immediately I get your past history and what treatment you're on, regardless of which healthcare provider you have been to. The challenge with that is that healthcare data is not very structured. Like in your bank account, you know this is the money, this is the credit, this is the ledger. Is very standardized form of data in finance. In healthcare, it's not very standardized. My database structure looks very different from what the other hospitals are doing. I think that's where LLM layer on top can help standardizing that data because there is contextual understanding. So that will happen very soon, I think.
Yeah, that's good to know because I know I've worked in AstraZeneca in UK, and when they were developing the vaccines, one of the reasons they could cater to the speed is because of using natural language processing in data mining the clinical data sets. So which used to take months, and now in a click of a button you can get, you can put keywords and data mine. So that was really one of the things that is an outcome of AI, and we are proud to say that we develop vaccines in no time. So I think so when I was Googling this topic and trying to make myself more educated in it, one of the keyword that was coming up was care pods. And it seems like it's almost like a photo booth kind of a place where you can get your tests done, and in no time there is it's connected to an AI, the robot system or information system, and it gives out your results and also analysis of the results. So I just felt that if we have the government infrastructure, this could be an amazing thing, especially in the remote areas where there is scarcity of doctors. So I just wanted to know both your thoughts about care pods, and is it going to be a reality in the near future in India, or are we far away from there?
Basically in healthcare, we need to test something. So anything that can be tested on site is possible. Your blood pressure, your regular ECG or anything on that. But most results come from pathology and biochemistry and all of that, which can't be done on site. You need larger machines to do it. So it can't be instantaneous when it comes to actually diagnosing what is wrong with you. So I think there would be upgrades in primary healthcare centers. They'll get more digitized. AI comes much later in those parts, especially if I'm talking in the rural places. But yes, I think input of data becomes through AI very soon, where conversations are recorded and given as prescriptions. That will have faster penetration than complete automation of the results.
Because some of the tests take days
yeah,
to
you need to run it
give
on
the
a batch
results.
like a factory.
Yeah. But the tests that could be done instantaneously, for
Yeah.
example, an ECG or something like that, could that be?
That can be done today itself. So
Okay.
Yeah, like when you talk about care pods and this mobile medical units, you may call them. Here, my opinion would be like India till today has always, the trend was detect and treat. But I think that mindset is slowly shifting, and we are concentrating, even we, all of us have become more aware of our health, and we are concentrating on screen and prevent. So I think these care pods and mobile medical units can actually play a very important role in this screen and prevent mindset. So where like you take this, install it in different locations, it can be unmanned or it can be manned by a single person, or it can be remotely managed. And there you can screen, you can take certain parameters, like some of the tests are possible to get results at there. Many of the tests, as Ranabir mentioned, are not possible to do there because the results cannot come there. But some of the areas at least I think we can address. Like say for example, if somebody is suddenly facing some difficulty, some of his hands or legs are not properly working, like some shivering is happening, some sort of that, like if it's a probable stroke patient, or there may be a chances of cardiac arrest or some problem in the heart, and the initial ECG predicts something. So at least those patients can be immediately transformed. They can be screened and then transformed, or earlier screening will result in further screening of those patients, and then you actually prevent that disease to happen through certain lifestyle changes or whatever the medical treatments are there. So yes, like to my opinion, care pods can actually play a very important role, especially where we are unmanned with, like where we are in low in numbers of doctors and medical professionals. At least some areas it can definitely help us.
So you're saying that more in the preventive aspect rather than
more
curative.
from the preventive healthcare aspect, yes. And with the application of AI, introduction of AI, like the software, some of the softwares may be AI driven, some inputs, some results we can get out of it, which can predict a lot of things.
Well, thank you. I think we are coming to the end of the session, and it was great talking to you both, and it looks like a lot has been done. And thanks for educating us on this topic, and there's more to do. So let us all get to work, and thank you. Thank you for your time, and thanks for being a patient crowd.